Lieutenant Sarah Chen had been driving the same dusty road through Pine Ridge, Texas for 3 years. Every morning, she made the 40-minute commute from the small military base where she served as a combat medic trainer to the local veterans hospital where she volunteered on her days off. Most folks in town didn't pay much attention to her. She was quiet, kept to herself, and that was just fine. On that humid Tuesday morning in August, Sarah noticed the traffic was lighter than usual. The two-lane highway cut through flat farmland, with nothing but fence posts and the occasional barn breaking up the endless horizon. She had her window down, letting the warm air blow through her short black hair when she saw it. About a quarter mile ahead, a pickup truck swerved violently. It happened so fast. The truck crossed the center line, overcorrected, and then flipped. Once, twice, 3 times. Metal screamed against asphalt. Glass exploded into the air like deadly rain. The truck finally came to rest on its roof in the shallow ditch beside the road. Sarah's training kicked in before her mind could even process what she'd seen. She slammed on her brakes and pulled onto the shoulder. Her heart pounded, but her hands were steady. They always were in a crisis. That's what 12 years in the Army had taught her. She grabbed the medical kit she always kept in her backseat and ran toward the wreck. The smell hit her first: gasoline, hot metal, and something else. Blood. As she got closer, she could see a man trapped inside, hanging upside down from his seatbelt. His face was covered in cuts and blood dripped onto the truck's ceiling. "Sir, can you hear me?" Sarah dropped to her knees beside the shattered driver's side window. The man's eyes flickered open. He was young, maybe 25. Through the blood, Sarah could see the distinctive high-end tight haircut. Military. And there on his torn shirt she caught sight of it, the eagle, globe, and anchor. He was a Marine. "Stay with me," Sarah said firmly. "I'm a medic. I'm going to get you out." The Marine tried to speak, but only a groan came out. Sarah did a quick visual assessment. His left leg was twisted at an unnatural angle, definitely broken. But what worried her more was the piece of metal from the dashboard that had pierced his abdomen. If she moved him wrong, he could bleed out in minutes. She heard a car pull up behind her. A middle-aged man in a business suit approached. "Oh my God, should I call 911? "Yes, now." Sarah didn't look away from her patient. "Tell them we need an ambulance immediately. Serious injuries, possible internal bleeding." The man ran back to his car. Sarah turned her attention to the Marine. "What's your name, Marine?" "Sea Corporal James Morrison," he managed to say. "Okay, James, I'm Lieutenant Sarah Chen. I need you to stay very still for me. Can you do that?" He nodded slightly, his eyes showing fear now. He understood how bad this was. Sarah worked quickly. She couldn't remove the metal piece. That would make the bleeding worse. Instead, she stabilized it as best she could with materials from her kit. She checked his pulse. Too fast, too weak. He was going into shock. "James, look at me," she commanded. His eyes found hers. "You're going to be fine. I've treated worse than this in Kandahar. You're not dying on this highway. You understand me?" "Yes, ma'am," he whispered. More cars had stopped now. People stood at a distance, watching, but no one came closer. Sarah heard someone say, "Is she a nurse or something?" Another voice answered, "I don't know. She seems pretty small to be handling this." Sarah ignored them. She'd heard comments like that her whole career. At 5'3" and barely 110 pounds, people always underestimated her. Let them think what they wanted. This Marine needed her and nothing else mattered. The gasoline smell was getting stronger. "Everyone back," Sarah shouted. "This vehicle could catch fire. Get back to a safe distance." The onlookers retreated, but Sarah stayed. She wasn't leaving James. The ambulance arrived 12 minutes later, though it felt like hours. Sarah had kept James conscious the whole time, talking to him about his family, his base, anything to keep him focused. She gave the paramedics a rapid-fire briefing on his condition, using medical terminology that made them look at her with new respect. "You military. one of them asked as they carefully loaded James onto the stretcher. "Army medic," Sarah replied. "I'm riding with you." "Ma'am, we usually don't allow." "I said I'm riding with you." Her voice was quiet but steel hard. "I've been keeping him stable for the past 12 minutes, and I'm not stopping now." The paramedic nodded and stepped aside. During the 20-minute ride to Mercy General Hospital, James's condition worsened. His blood pressure dropped. Sarah had the paramedics start an IV and administered fluids. She monitored his vitals constantly, her trained eyes catching every dangerous change. "We're losing him," the younger paramedic said, panic creeping into his voice. "No, we're not," Sarah said calmly. She adjusted the IV flow and checked James's pupils. "His body's just trying to protect itself. Keep that oxygen mask secure and watch for any change in his breathing." When they pulled up to the emergency room, a team was waiting. Sarah jumped out and started rattling off James's vitals and the treatment she'd given. A nurse tried to wave her away. "Miss, you need to step back and let the professionals." "I am a professional," Sarah interrupted. "Lieutenant Sarah Chen, U.S. Army, combat medic with 12 years of field experience. Now, are you going to listen to my report or waste time while this Marine's condition deteriorates?" The nurse's mouth snapped shut. Sarah gave her complete assessment in under 60 seconds, then stepped back as the team wheeled James through the doors. She wanted to follow, but security stopped her. "Family only beyond this point," the guard said. Sarah nodded. She was suddenly exhausted. Her uniform was covered in blood, James's blood. Her hands were shaking now, the adrenaline finally wearing off. She found a chair in the waiting room and sat down, closing her eyes. "Excuse me." A soft voice interrupted her thoughts. Sarah opened her eyes to see an elderly woman standing there, worry etched on her face. "Are you the one who saved that young man, the Marine?" "I just did what anyone would do," Sarah said quietly. The woman shook her head. "No, dear, most people would have driven right past or they would have panicked. My husband's brother saw the whole thing. He said you were incredible." She reached out and touched Sarah's hand. "Thank you." Before Sarah could respond, a commotion erupted near the emergency room doors. A tall man in surgical scrubs came striding out, his face red with anger. He was probably in his 60s, with silver hair and the kind of presence that demanded attention. "Where is she?" he barked at the nurse's station. "Where's the person who treated the Morrison patient before he arrived?" The nurse pointed toward Sarah. The surgeon turned, his eyes narrowing as he took in her small frame and blood-stained uniform. "You," he said it like an accusation. "You're the one who supposedly treated a critically injured patient at the scene." Sarah stood up, meeting his gaze steadily. "Yes, sir. I stabilized him until the ambulance arrived." "And what exactly are your qualifications?" His tone was dripping with condescension. "Did you take a first aid class at the community center?" Several people in the waiting room had turned to watch. Sarah felt her face flush, but she kept her voice level. "I'm a lieutenant in the U.S. Army and a certified combat medic. I've treated trauma patients in—" "You're a medic," he interrupted, practically spitting the word. "Not a doctor, not a surgeon, a medic." He took a step closer. "Do you have any idea what you've done? That young man has a punctured bowel, internal bleeding, and God knows what else. Your amateur treatment may have made everything worse." "I stabilized his vitals and prevented him from going into shock," Sarah said quietly. "The metal fragment in his abdomen was—" "Don't presume to tell me about medical treatment," the surgeon snapped. "I'm Dr. Richard Thornton. I've been practicing medicine for 35 years. I'm the chief of surgery at this hospital, and I've seen too many cases ruined by well-meaning amateurs who think they know what they're doing." Sarah felt like she'd been slapped. Around them, people were staring. Some looked sympathetic. Others seemed to agree with the doctor. "Now, I need you to give a full statement of everything you did to my patient," Dr. Thornton continued. Because if anything goes wrong in that operating room, I need to know exactly what complications your interference may have caused. Sarah spent the next 3 hours being questioned, first by Dr. Thornton's assistant, then by hospital administrators, and finally by a stern-faced woman from the hospital's legal department. They wanted to know every detail of what she'd done at the accident scene. Sarah answered every question professionally, despite the clear implication that she'd done something wrong. She could see it in their faces. They thought she was just some small-town soldier playing hero, probably making things worse while trying to help. "And you moved the patient?" the legal representative asked, pen poised over her notepad. "No, ma'am. I specifically did not move Corporal Morrison because of the penetrating abdominal injury. I stabilized him in place." "But you did administer fluids." "Yes, he was going into hypovolemic shock. Standard protocol." The woman's lips pressed into a thin line. "Protocol you learned in the military." "Protocol I learned in the military, in civilian trauma courses, and through 12 years of practical experience," Sarah replied evenly. When they finally let her go, Sarah walked out of the hospital feeling worse than she had in years. Not because she doubted what she'd done. She knew she'd saved James Morrison's life. But because once again, she'd been judged and found wanting simply because of how she looked, because of assumptions people made about her. She was halfway to her car when her phone rang. It was her commanding officer, Colonel Martinez. "Chen, where are you? You were supposed to be at the training facility 2 hours ago." Sarah closed her eyes. She'd completely forgotten. "Sir, I apologize. There was an accident. A Marine was injured and I heard," Martinez interrupted. His voice softened. "Just got a call from Mercy General. They're trying to determine if you're actually qualified to have done what you did. I set them straight, but Sarah, maybe you should have just waited for the ambulance." "Sir?" Sarah couldn't believe what she was hearing. "You know how it is. You help someone, something goes wrong, and suddenly you're liable. Maybe it's better to just stay out of it." After she hung up, Sarah sat in her car for a long time. Stay out of it. Don't help. Don't get involved. Just because she might be blamed if something went wrong. Was this really what it had come to? Her phone buzzed with a text from her younger sister, Emily. "Heard what you did. So proud of you. You're a hero." Sarah smiled sadly. Emily always believed in her. But Emily was in California, far from Pine Ridge and the whispers that were probably already spreading through the small town. The military medic who thought she was a doctor, who interfered with a dying man, who might have made things worse. 3 days passed. Sarah returned to her duties at the base, training the next generation of combat medics. She threw herself into work, trying not to think about James Morrison or Dr. Thornton's accusations. But then, on Friday afternoon, Colonel Martinez called her into his office. "Chen, sit down." His face was grave. Sarah's stomach dropped. "Sir, I received a call from Mercy General. They want you to come in for a meeting, next Monday at 10 a.m. "What kind of meeting?" Martinez shook his head. "They wouldn't say, but Sarah, you might want to bring a lawyer." That weekend was the longest of Sarah's life. She couldn't afford a lawyer, not on her salary. She called a few friends who'd been in similar situations, asking for advice. Most of them told her to cooperate fully, be honest, and hope for the best. On Sunday night, she barely slept. She kept replaying the accident in her mind. Had she done something wrong, missed something? She treated hundreds of patients in worse conditions in Afghanistan and Iraq. She'd saved lives under enemy fire. But now, in her own country, she was being treated like she'd committed a crime for doing her job. Monday morning arrived too quickly. Sarah put on her dress uniform, the one with all her ribbons and medals. If they were going to judge her, they might as well see exactly who they were judging. She arrived at the hospital at 9:45 a.m., her spine straight, her head high. The receptionist directed her to a conference room on the third floor. Sarah's hands were cold as she turned the doorknob and walked in. The room was full of people. Dr. Thornton sat at the head of the table, his expression unreadable. Around him were several other doctors, nurses, and administrators. And there, in a wheelchair by the window, was James Morrison. He was alive, pale, bandaged, but alive. "Lieutenant Chen," Dr. Thornton said, standing, "thank you for coming." Part 4, The Truth Revealed. Sarah stood just inside the doorway, her heart pounding. James Morrison looked at her and smiled, a weak smile but genuine. His mother sat beside him, a woman in her 50s with red-rimmed eyes and James's same brown hair. "Please sit down," Dr. Thornton said, gesturing to an empty chair. Sarah sat, her back rigid, her hands folded in her lap. Whatever was coming, she would face it with dignity. Dr. Thornton cleared his throat. "Lieutenant Chen, I asked you here today because I owe you an apology." Sarah blinked. That was not what she'd expected. "When you brought Corporal Morrison in last Tuesday, I made assumptions, very unfair assumptions." The surgeon's voice was rough, as if the words were difficult for him. "I assumed that because you were young, because you were small in stature, and because you were not a doctor, that you couldn't possibly have provided adequate care." He paused, looking down at his hands. "I was wrong, completely wrong. In my 35 years as a surgeon, I have rarely seen such perfect field trauma care. The way you stabilized the penetrating object, the timing of your fluid administration, your management of his shock, it was textbook perfect. More than that, it was the work of someone who has seen real combat trauma and knows how to think under pressure." Sarah's throat tightened. She didn't trust herself to speak. Dr. Thornton continued, "When we took Corporal Morrison into surgery, his chances were 50-50 at best. The metal fragment had pierced his small intestine and came within millimeters of his femoral artery. If you had moved him, if you had tried to remove that metal, if you had done anything differently, he would have bled out at the scene. He would be dead right now." James's mother let out a small sob. James reached over and took her hand. "But he's not dead," Dr. Thornton said. "He's alive because of you, because you knew exactly what to do and had the courage to do it." The surgeon stood and walked around the table to stand in front of Sarah. "I judged you based on appearances and assumptions. I was arrogant and dismissive, and I am deeply, profoundly sorry." He extended his hand. Sarah stood and shook it, still too stunned to fully process what was happening. "There's more," Dr. Thornton said. "After I calmed down and actually reviewed what you'd done, I started asking questions. I called your commanding officer. I spoke with doctors at Walter Reed who'd worked with you. I learned about your service record." He turned to address the others in the room. "For those who don't know, Lieutenant Chen has served 3 tours in Afghanistan and 2 in Iraq. She's been awarded the Bronze Star for Valor after she saved 6 soldiers during a firefight. She's trained over 200 combat medics who are currently serving in the field, and she's never lost a patient when she's been first on scene." One of the other doctors at the table, a young woman, started clapping. Others joined in. Sarah felt her face flush red. "Please," she said quietly, "I just did my job." "No," James Morrison spoke for the first time, his voice weak but clear. "You did more than your job. My mom told me everything. You stayed with me even when people told you to step back. You rode in the ambulance. You fought for me." Tears rolled down his cheeks. "I remember you telling me I wasn't going to die. I believed you, and you were right." His mother stood and came to Sarah, pulling her into a fierce hug. "My son is alive because of you," she whispered. "My baby boy is alive." Sarah hugged her back, her own eyes stinging with tears now. When they separated, Dr. Thornton spoke again. "Lieutenant Chen, I have a proposal for you. I've discussed this with the hospital board, and we would like to offer you a position here at Mercy General. We want you to develop and lead our emergency trauma response training program. You would train our ER staff, paramedics, and first responders in the kind of field trauma care that saved Corporal Morrison's life." Sarah stared at him. I'm still active duty. I can't just leave the Army. We know, said one of the administrators, a kind-looking man with glasses. We've already reached out to the Department of Defense. There's a program that allows military medical personnel to take temporary assignments in civilian hospitals, especially in underserved areas. Pine Ridge qualifies. If you're interested and if the Army approves, you could split your time between the base and here. Sarah's mind was racing. This was everything she'd ever wanted: respect, recognition, a chance to use her skills to help her community. But part of her was still waiting for the catch, for the moment when they'd pull it all away. Why, she asked, why are you doing this? Dr. Thornton smiled, the first genuine smile she'd seen from him. Because I'm old enough to admit when I'm wrong and smart enough to recognize exceptional talent when I see it. You belong in medicine, Lieutenant Chen. Not just in the military, but here, training the next generation, teaching them what you know, saving lives. 6 months later, Sarah stood in the Mercy General Conference Room, looking out at a group of 30 paramedics, nurses, and first responders. They were all watching her intently, notebooks open, ready to learn. The most important thing to remember about trauma care, Sarah said, pointing to the mannequin on the table, is that your first instinct might be wrong. You see a piece of metal sticking out of someone, your instinct says, pull it out. But in many cases, that object is the only thing preventing catastrophic bleeding. She demonstrated the proper way to stabilize a penetrating wound, her movements efficient and practiced. The class watched in silence, absorbing every word. It had been an incredible 6 months. The Army had approved her temporary assignment, and she now spent 3 days a week at Mercy General and 4 at the base. Dr. Thornton had become not just a colleague but a mentor and friend. He told her privately that her arrival had reminded him why he became a doctor in the first place, not for ego or prestige, but to heal people and pass on knowledge. The trauma training program had been a massive success. Emergency response times in Pine Ridge had improved by 40%. Patient outcomes were better, and Sarah had trained over 100 medical professionals in advanced field trauma care. But more than that, she'd found her place. People in town recognized her now. They waved when she drove by. They stopped her in the grocery store to thank her or ask medical questions. She was no longer invisible. After class, as Sarah was packing up her materials, Dr. Thornton appeared in the doorway. "Got a minute?" he asked. "Of course." He handed her an envelope. "This came from the Marine Corps Association. I think you'll want to open it." Sarah carefully opened the envelope and pulled out a letter. As she read, her eyes widened. "They want to give you the life-saving medal," Dr. Thornton said, beaming. "James Morrison nominated you. His testimony about what you did that day was, well, it was moving. They're having a ceremony next month." Sarah looked up, tears in her eyes. "I don't know what to say." "Say you'll accept it. And say you'll keep doing what you're doing." Dr. Thornton's expression grew serious. "Sarah, I was wrong about you that first day, but I wasn't the only one who's ever underestimated you, was I?" Sarah shook her head. "No, it's happened all my life. I'm small, I'm quiet. I'm a woman in a male-dominated field. People make assumptions. And you prove them wrong every time." Dr. Thornton smiled. "That's what makes you remarkable. Not just your skills, but your grace under pressure, your refusal to become bitter or angry, your dedication to doing the right thing even when no one's watching." A week later, Sarah received another surprise. She was called to Colonel Martinez's office, where she found not just the colonel, but a 2-star general she'd never met before. "Lieutenant Chen," the general said, "I've been reviewing your service record and your work here in Pine Ridge. It's exceptional. I'm here to inform you that you've been selected for early promotion to captain. Additionally, the Army Medical Corps wants you to develop a new training program based on what you've built here, a bridge between civilian and military trauma care that can be implemented at bases across the country." Sarah felt lightheaded. Captain, a national training program. It was more than she'd ever imagined. There's one condition, the general continued. You'd have to leave Pine Ridge. The program would be based at Fort Sam Houston in San Antonio. Sarah looked at Colonel Martinez, who gave her an encouraging nod. Then she thought about everything she'd built here, the community that had finally accepted her, Dr. Thornton and the team at Mercy General, James Morrison, who still came by the hospital to visit and who'd become a friend. "Sir," Sarah said slowly, "I'm incredibly honored, but I'd like to request a modification to that assignment. Could I develop the program remotely and travel for implementation? I'd like to continue my work here in Pine Ridge as well." The general raised an eyebrow. Most officers would jump at a chance to leave a small town like this for a big base like Sam Houston. "I'm not most officers, sir," Sarah said with a slight smile. "Pine Ridge gave me a chance when I needed one. These people trusted me. I don't want to abandon that." The general looked at her for a long moment, then nodded. "I can respect that. Let me see what I can arrange." 2 weeks later, Sarah got her answer. The Army would allow her to stay based in Pine Ridge while developing the national training program. She would travel as needed but could maintain her work at both the base and the hospital. The night before the Marine Corps ceremony, Sarah had dinner with Dr. Thornton and his wife at their home. Over dessert, Dr. Thornton's wife, Margaret, said something that stuck with Sarah. "You know what I admire most about you, dear? You didn't let Richard's cruelty break you. A lot of people would have walked away or gotten angry or given up. But you just kept being who you are, a healer, a teacher, a good person." Sarah thought about that. She'd certainly been angry, she'd certainly been hurt, but Margaret was right, she hadn't let it change her. "I had good examples," Sarah said. "My parents taught me that you can't control how people treat you, but you can control how you respond. And the Army taught me that sometimes the hardest thing and the right thing are the same thing." The medal ceremony was held at the Marine Corps Base 2 hours from Pine Ridge. Sarah wore her dress uniform, nervous despite herself. James Morrison was there, walking now with just a slight limp. His whole family came. So did Dr. Thornton, Colonel Martinez, and to Sarah's surprise, dozens of the paramedics and first responders she'd trained. When the commandant presented her with the medal, he told the story of what she'd done that day on the highway. He talked about courage and skill and dedication. But what moved Sarah most was what James said when he was invited to speak. "Lieutenant Chen saved my life," he said simply. "But she did more than that. She showed me what real strength looks like. It's not about being the biggest or the loudest. It's about knowing what needs to be done and doing it even when it's hard, even when people doubt you, even when you get nothing but criticism for trying to help." He looked directly at Sarah. "You're my hero, ma'am, and I'm proud to know you." That night, driving home to Pine Ridge, Sarah thought about the journey that had brought her here. From being dismissed and insulted by Dr. Thornton to receiving one of the military's highest civilian honors. From being invisible in this small town to being recognized and respected. But more than any of that, she thought about James Morrison, alive and healthy. She thought about all the people she'd trained who were now out there saving lives. She thought about the program she was building that would help train thousands more. The recognition was nice. The medals and promotions were wonderful. But in the end, what mattered most was simple. She was doing what she was meant to do, helping people who needed help. As she pulled into her driveway, her phone buzzed with a text from Dr. Thornton. "Proud of you, Captain Chen. See you Monday." Sarah smiled. Monday she'd be back in that classroom, teaching another group of first responders. Back to the work she loved, in the community that had become her home. She'd been underestimated and dismissed, judged and doubted. But she'd never stopped being who she was, a healer, a soldier, a woman who refused to give up on doing the right thing.